A lot of times, people don't call, don't do anything. With this last seizure that I had, as close as I can figure, I was walking around Franklin Avenue at 6:30 in the evening for 45 minutes probably before I walked into a neighborhood restaurant and a friend of mine saw me and grabbed a hold of me and determined I needed medical attention and took me to the hospital. But the blood was already dry on my face.
As a law enforcement officer, you may be called to aid someone having an epileptic seizure. Epilepsy is a chronic neurological disorder which often begins in childhood. It takes the form of brief malfunctions in the brain when an overload of electrical energy passes between cells. This discharge may stay in just one small area of the brain, or it may spread through the entire system. During a seizure, the person's consciousness, behavior, bodily functions, sensation, and motor activity are altered. Epilepsy is not contagious.
Sometimes you'll develop a pattern that will let you know that you're getting close to having a seizure. And, you know, if you recognize the warning signs, there are things that you can do. But you'll go along with the same pattern for 3 or 4 or 5 years, and then all of a sudden, out of the blue, it'll change. And you can't escape feeling like a walking time bomb.
6-9 Adam 1, 6-7 Edward 1, suspicious person, parking lot, Florin Mall.
In its milder form, called a partial seizure, a person may be incoherent, glassy-eyed, wandering aimlessly, or unresponsive. Their confused behavior may be mistaken for a drug or alcohol stupor, or look like illegal activity, such as trying to get into the wrong car. Phenobarbital, a barbiturate, is often used to treat the condition. If the smell of alcohol is totally absent and the person regains normal consciousness within a few minutes, they're probably having a seizure.
There's a lot of uncertainty in approaching these situations. Your primary concern, of course, is your safety and the safety of other people that are around you. As I got out and talked to him, I didn't get any response initially. Sir, come on over here. Sir, I need to talk to you. And that's not usual for somebody who's involved in criminal activity. But at the same time, if I call out to that person a couple of times and they don't respond to me, I can't just let that person walk away. The difference between somebody having a seizure and somebody who is trying to resist me is that the person having the seizure, once I let go of them, the resistance ends. Sir, are you okay? He just then continued to fumble with his clothes. I saw the lip smacking. He was wearing a medical alert bracelet. So I had an indication at that point that there was some kind of a medical problem going on, not some kind of criminal behavior. You okay? So then I got to be concerned with his safety. Is he going to hurt himself? Is he going to step out into traffic?
What you want to do is to guide them to a safe area, avoid any hazards in their way, talk to them reassuredly.
You okay? You know where you are?
A lot of the symptoms that epileptics display just before and just after a seizure look a lot like drug overdoses.
The most severe form of epileptic seizure, called grand mal or tonic-clonic, is characterized by convulsions. If you respond to a person having a seizure, first of all, protect him or her from injury. If there's an object nearby, such as a table or chair, move it away. As quick as possible, turn the person onto their side and put something under their head for support so they don't injure themselves.
My name's Mike. I'm with the police department. I'm going to help you, okay?
Being placed on one side keeps the airway clear. A person having a seizure can't swallow their tongue, so nothing should ever be put in the mouth. Although not everybody with epilepsy wears one, always check to see if there's a medical ID.
Everything's going to be all right.
When a person with epilepsy has a seizure that ends without injury after a minute or two, it's usually not necessary to call an ambulance. If the seizure lasts longer than 5 minutes, or if you can tell it was caused by some other medical problem like diabetes, an ambulance should be called immediately.
Can you tell me what your name is?
My name?
With both types of seizures, there's a period of confusion afterward. They're exhausted, and it takes time for them to recover.
You can't just, okay, you're having a seizure, we'll walk off. You must be sure that that person hasn't injured himself and that he's oriented, where he knows where he's going or she knows where she's going.
Are you here alone, or are you with someone?
Yeah, my wife.
Your wife?
I'm here with my wife, yes.
Okay.
When they're coming out of their seizure, I'm asking, how are they? Do they know where they're at? Do they know what happened? I'll ask them if they do have epilepsy, if they're taking medication, if there's somebody that I can call for them.
If it was your relative or a friend of yours who had a seizure disorder, or yourself, you would expect the same treatment.
When responding to a call that may involve a person with epilepsy, remember, be alert for seizure symptoms, protect the person from injury, place nothing in their mouth, and don't restrain the person. Offer help during recovery. If they're in your custody, make sure they get their medications on time. Sometimes, seizures occur when someone with epilepsy is being questioned by the police or is arrested.
If we arrest somebody and they have epilepsy, that stress under that situation can trigger a seizure.
If a person is arrested and they have a seizure medicine, it's important they be allowed to take that medicine.
If we find medication on them, and we do have what they call medical support staff at the jail, we tell the jail staff, hey, this is what we found on them, and you need to check it.
Some of the seizure medications need to be taken at intervals of every 6 hours. And if they miss that medicine, the chances of them having a seizure could be quite high.
We immediately notify the custody nurses who make a note of it and ensure that they get their medication on schedule, so there's not an interruption.
I have run into a couple of people who very obviously saw me on the street after this last seizure, and they looked at me with absolute horror in their eyes. And hopefully the horror is at themselves for not doing anything. Hopefully the horror is not directed at me because I'm a freak, because I'm not a freak.